What's up guys, Jeff from Sorta Healthy here. In today's video, we'll be going over a bunch of different things with a few goals, but really one in particular. I'm going to give you the knowledge necessary to crush the ISSA and NCCPT personal training exams. The ISSA CPT test is open book or non-proctored, so it's usually not too challenging if you know the material at least somewhat well. That being said, do you actually feel like you know the ISSA training material? Well, if you stick with me here today, you absolutely will very soon. I think many of you will find this video extra helpful because it's also designed to help you pass the NCCPT personal training test that comes with ISSA packages. The NCCPT exam is not open book. You will be watched by someone on a webcam while you're taking it, so no looking at anything other than the test, which is fairly challenging for most. And considering that many gyms will want you to pass this NCCPT test in order to begin working as a trainer, well, I'm confident that many of you will find this guide very helpful. As far as who I am, well, I'm the guy who's helped trainers to pass more of these tests than just about anybody else. NASM, ACE, ACSM, NSCA, and now ISSA and NCCPT. I'm going to help you guys crush this thing, so let's get to that now. The study guide that I'll be referencing today is free to download at sortahealthytrainered.com. If you'd rather just follow along to this video, that works perfectly well too. All I ask in exchange for this free video and guide is that you like the video and subscribe to the channel if you haven't done so already, as that really helps us out and allows me to keep making free personal trainer education content for all of you. Thank you so much for that support, guys. I really appreciate it. Moving on to the good stuff. So first things first, I don't work for ISSA or the NCCPT. I just help trainers to learn useful information and skills. That's kind of my thing. We've got 3 steps to pass the ISSA and NCCPT tests. First, you should skim the ISSA book and complete all the practice quizzes along the way. When I say skim the book, I really do mean skim the book. Don't go crazy memorizing everything. The next step is to review this part 1 video and the part 2 videos a few times each. This part 1 video teaches you the ISSA and NCCPT material, and the part 2 has trivia questions to help you test your knowledge and learn a few more things. Part 2 is out now, by the way. Watch it after this one. The third thing to consider is taking a practice exam. Obviously, I'm biased, but I think we have the best one. It's only $19.97, and it has 50 trivia questions where I personally help you to learn the material more in depth. I will be teaching you a bunch of things and telling you why some answers are right and others are wrong. I think these extra explanations will be helpful for many of you, and if you're thinking about taking the NCCPT test, I do think the additional practice could be very helpful, so something to think about. As far as today's learning goes, let's kick things off with goal setting, specifically SMART goals. So specific, measurable, attainable, realistic, and timely goals, and you do want clients' goals to be SMART goals. When we're talking about specific, someone saying they just want to lose weight, well, that really might not be good enough. They're more likely to actually lose weight if they know roughly how much weight they want to lose. Maybe they want to lose 20 pounds. So again, you have to kind of figure that out with your client. Measurable is pretty easy for us because most metrics in our world are very easy to measure. Again, if someone's trying to lose weight, pounds would be the measurement that you're looking at. Obviously, if someone's main goal is to improve their bench press, you're also looking at pounds there, but now you're looking at pounds added to the bar over a period of time. Attainable is pretty simple. You want to set goals that are actually possible to achieve, so just keep that in mind. R can stand for realistic or relevant. I have realistic down here, but oftentimes relevant will also be the thing that it could stand for, so keep that in mind. Anyway, your goal should be realistic or relevant to your life or the life that you're trying to move into. And then for timely, give yourself time to achieve a goal, but you should have some sort of a deadline, even if it's just a soft deadline. So next up, we're talking about intrinsic and extrinsic motivation. Intrinsic motivation comes from within. It's the desire to do something because the activity itself is enjoyable, interesting, or personally satisfying. Typically, intrinsic motivation is more powerful. If that motivation comes from within or from liking the activity, people are more likely to stick with it. You also have extrinsic motivation, and that occurs due to a potential reward or avoiding punishment. So if I have a client training for a bodybuilding competition and they want to look really good up on stage, well, in a way, that is kind of a reward, especially if there's a big trophy on the line. They could also be avoiding punishment. Maybe their doctor told them they have high blood pressure and they need to get in the gym to work on that. So that would all be extrinsic motivation. Typically, Intrinsic motivation is a little bit more powerful. So some examples here for intrinsic motivation: hitting the gym because you like how you feel afterwards, joining a running club because you enjoy running with your peers. Again, we are increasing that enjoyment from the exercise itself, and that typically comes from within. Extrinsic motivation: doing your homework so you don't get detention. Yeah, you're avoiding punishment there. Lifting weights to look good and show off for your friends. Yeah, you are lifting weights to look good. That's the prize, right? You're looking good for your friends, looking good for your peers. It's not necessarily for your own enjoyment, but I suppose you do get some enjoyment from looking good, but it's external and it's to show off. It's a prize. So we have the self-determination theory. It's a psychological framework that explains human motivation by proposing that people are driven by three needs: autonomy, feeling free and in control of one's choices; competence, feeling capable and skilled in one's actions. Basically, are you good at doing something? And relatedness, feeling a sense of connection and belonging with others. So, self-determination theory, I'm just going to read it back to you a second time because I feel like doing that is going to help. The self-determination theory is a psychological framework that explains human motivation by proposing that people are driven by three needs. You have autonomy first, which is when you feel free and in control. You have competence, which is feeling capable and skilled in one's actions. And you have relatedness, which is feeling a sense of connection and belonging with others. Motivational interviewing, MI, is a collaborative counseling method that helps individuals change problematic behaviors by exploring and resolving their mixed feelings and strengthening their intrinsic motivation for change. ORS is a part of this. ORS stands for open-ended questions, affirmations, reflective listening, and summarizing. O stands for open-ended questions. Ask your clients open-ended questions such as, why are you interested in losing weight? And this is to get a deeper understanding of their motives. Affirmations are compliments for your clients, and you want to use these to boost morale and to build rapport. If a client is doing something wrong, address it, but possibly follow it up with an affirmation. Reflective listening is basically when you repeat something back to a client to show that you understood them. If Sarah told me she wants to lose some weight, I might say, okay, Sarah, you want to lose some weight. How do you feel like I can best help you with that? The last piece of ORS is summarizing. This is the same as reflecting, but now you're reflecting multiple pieces of information. I might say your husband is always bringing home pizza, and you're worried that that's going to make it a little bit tougher to lose weight. Of course, this would be right after she told me those two things, and then I'd be reflecting back those multiple pieces of information. So for the upcoming anatomy section especially, but really for this entire video, don't bother memorizing too much info, but listen to what I say and absorb as much as you can. You'll probably want to listen to everything a few times. So anyway, there's 206 bones in the human body. The axial skeleton has 80 bones, and that is the core of the body, and that includes the skull, the ears, the neck, the back, and the rib cage. You also have the appendicular skeleton, and that has 126 bones, and that's the limbs or the appendages. So within your body you have osteoblasts, and these are cells that build or repair bone. The opposite of that is an osteoclast, and those destroy bone. What is the longest bone in the body? That is the femur, or this upper leg bone that you can kind of see in this picture over here. The patella or kneecap is a sesamoid bone, which you can see the patella or kneecap right here. So there are four main types of bones: long bones, short bones, flat bones, and irregular bones. Sesamoid bones, like the kneecap we just described, would often be kind of lumped into irregular bones. So the human movement system, or kinetic chain, is made up of the skeletal system, the muscular system, and the nervous system. So the skeletal system provides support and protects organs. It's the body's foundation. It makes blood for the body, and it stores necessary minerals. The muscular system links the nervous and skeletal systems together. It allows for movement, and there are three different types of muscle. You have skeletal muscle. Skeletal muscle is muscle that you have direct control over. So if I'm doing this motion right here, my biceps are doing that motion. My biceps would be skeletal muscle. Smooth muscle would be things internal. For example, you have smooth muscle in your stomach and other organs. And cardiac muscle is in the heart. And again, skeletal muscle is the one that we have direct control over. The other two, not so much. So synovial joints are the most common in the body, and there are a few different types of synovial joints. So your radius and ulna, these two arm bones right here, they form a pivot joint because they kind of pivot around like that. Now your knee, or actually your elbow here too, those are hinge joints because they kind of just hinge forwards and backwards in one direction. Condyloid joints, don't really have to worry too much about those, but you have some in your hand and your fingers, for example. Saddle and plane joints, don't really need to know too much about those. Ball and socket joints, well, you have one right here in your shoulder, also your hip, and they allow for a whole bunch of different ranges of motion. So next up, we're talking about the levels of organization in the human body. Essentially, as we kind of move down the chart here, things are getting bigger. So we have the atomic level, and that's just individual atoms. We have the molecular level, that's individual molecules, DNA, carbs, etc. Then we move on to organelle, mitochondria, nucleus, things like that, cells, tissue, organs, the whole organ system. And then we have the organism, which is the living thing, such as a person. And is this worth memorizing? Nope. Just like almost everything in this video, it's not worth memorizing, but it is worth looking over a few times and just understanding what I'm explaining to you. Moving on to the central and peripheral nervous system. The central nervous system consists of the brain and spinal cord. It's responsible for receiving, processing, and responding to sensory information. The peripheral nervous system is made up of nerves that extend from the spine to all other parts of the body, and they send info back to the CNS, or the central nervous system. Some good vocab to go over real quick here, definitely could pop up on the test. A neuron is a basic unit of the nervous system. A neuron has an axon, a cell body, and dendrites, and it allows you to do everything from breathing to running, pretty much anything. A sarcomere is the basic contractile unit of a muscle fiber, good to know, and a motor unit is made up of a motor neuron and the muscle fibers it innervates. So motor function is the brain's ability to perform purposeful movement. It includes voluntary and involuntary contractions. We have the all or nothing principle, and that is when a nerve or muscle cell will fire 100% or not at all. Muscle cells are going to either go full force, 100%, or they're not going to contract at all. Heavier resistance stimulates, should say more muscle fibers to fire. So if I'm bench pressing 200 pounds, basically all of the muscle fibers that are firing, they are firing 100%, but more muscle fibers are going to fire if I'm bench pressing 200 pounds versus 100 pounds. Just more muscle fibers activating, they all activate 100% or not at all. That is the all or nothing principle. So there's three layers that surround muscle tissue. The epimysium is the outermost layer. Then you have the perimysium, and that's the middle layer, and that's the sheath of connective tissue that surrounds a bundle of muscle fibers. Then you have the innermost layer, the endomysium, and that surrounds individual muscle fibers within skeletal muscles. Also good to know that ligaments, like your ACL for instance, attach bone to bone, and that tendons attach muscle to bone. Probably going to get a question about that. And guys, if you feel like your knowledge base is a little bit lacking when it comes to basic anatomy, which you should know some basic anatomy if you're becoming a personal trainer and if you're going to take this test, I do have 3 videos to help out with that. I have one that goes over basic bone anatomy, one that goes over basic upper body muscle anatomy, and the same thing for lower body muscle anatomy. Consider watching all of these once or twice before taking that big test. For example, if I were to hit you with a question like this, which of the below muscles extend the knee? A. Vastus lateralis, B. Biceps femoris, C. Rectus femoris, or D. A and C? You should be able to quickly figure out that D is the best answer to that question. You should note the quadricep muscles are the ones that extend the knee, so all the vastus muscles and the rectus femoris. You should also know that biceps femoris or femoris is a hamstring muscle, and the hamstrings do knee flexion, not extension. Again, the quads do extension. If any of that was confusing, you really should review these videos a few times and make sure you know the basic muscles and their actions. Don't go too crazy, just focus in on the big muscles and what they do. By the way, if terms like flexion and extension are foreign to you, keep watching because I'm going to teach you all of that stuff soon. But before that, onto some nervous system info. You have the sympathetic nervous system, which is part of the autonomic nervous system, meaning it kind of just kicks on whether we want it to or not. And the sympathetic nervous system is pretty much all about the fight or flight response. You can see this dude over here, he's ready to fight. You might also be ready to run away from something dangerous too. Fight or flight, sympathetic nervous system. The parasympathetic nervous system is also part of the autonomic nervous system, meaning it just kind of kicks on automatically, automatically. And that one's all about resting and digesting. So these two are kind of opposite to one another. Parasympathetic, rest and digest. The somatic nervous system allows you to control your body's movements and receive external stimuli. So unlike the sympathetic and parasympathetic, you do have control over your somatic. Speaking of muscle fibers, you have type 1 muscle fibers and type 2 muscle fibers. Type 1 muscle fibers are slow twitch. They are more important for endurance events. They're lighter and less powerful, and they're mostly aerobic, and that means oftentimes fat and just food in general, that's going to be fuel for these muscles. Then you have type 2 muscle fibers. They're fast twitch, they're larger and paler than type 1. They're anaerobic, meaning they don't require oxygen, and they're really used for short, explosive periods of physical activity, so sprints, heavy lifts, things like that, and they use carbs, glucose, things like that as fuel. So arteries carry oxygen-rich blood away from the heart to the rest of the body. I repeat, arteries carry oxygen-rich blood away from the heart to the rest of the body. Veins carry deoxygenated blood from the body to the heart, where it goes to the lungs to be reoxygenated. So veins are carrying deoxygenated blood, no oxygen in the veins. Capillaries are the smallest blood vessels and the site of exchange for nutrients, oxygen, CO2, things like that, and they provide nutrients to the tissues. Next up, we'll be talking about energy systems, and they are not a top priority, but there's a good chance that you're going to have a few questions about the different energy systems and how the body produces ATP. So ATP is adenosine triphosphate, and ATP molecules provide the body with energy. So if you get asked a question like, what is the main fuel source for the body? The answer is most likely ATP. Now we're going to move on to the chart on the next page. So essentially your body has a few different ways of creating ATP, adenosine triphosphate, and the first of which is the creatine phosphate system, which activates pretty much immediately, so 0 to 10 seconds, and you can see that with this red line right here. So if I'm doing something very short or intense, like a 40-yard dash or a heavy set of squats, I'm primarily using this creatine phosphate system. And this is why creatine works as a supplement. It slightly increases your body's creatine stores, which does give you a small edge for short and intense activities. So the first system here is anaerobic, meaning it does not require oxygen to create ATP. The next system is anaerobic glycolysis, and it lasts from about 10 to 60 seconds, and you could see this one just kind of outlined with this yellow line right here. So if you're doing an intense exercise that lasts from 10 to 60 seconds, which a lot of different weight training exercises would fall into that range, you're going to be primarily using this system, anaerobic glycolysis. And because we said anaerobic, this system here also does not require oxygen to create ATP in the body. And basically this system uses glucose to create ATP, and you can see that right down here where it says glycolytic. Yeah, that means glucose. So glucose for this yellow line right here. And the last system we have here is aerobic glycolysis, and since I said aerobic, not anaerobic, this system does actually require oxygen to create ATP. And this one kicks on a little bit later than the previous ones. Again, this one's usually jumping in around 60 seconds, and these are just estimates here, guys. These ranges can vary a little bit. But yeah, typically aerobic glycolysis is happening around 60 seconds and it's going longer. So yeah, if you're doing longer term exercise, of course, this one is going to take over ATP production compared to these other two. So in this pathway, carbs or fats are burned for energy production, ATP production, and that occurs in the mitochondria or the powerhouse of the cell. The aerobic system that we just described has other components like the Krebs cycle and the electronic transport chain. They can power the body for long periods of time. Think things like endurance events. No time frames for each system. Yeah, so I don't think you need to memorize everything we just went over by any means. That being said, if you get a question about the creatine phosphate system, it's good to know that 0 to 10 seconds, that is the main system that is powering the body. You by no means need to be an expert on all of this stuff, but you will likely get a question or two about it. Next up, we're moving to planes of motion and movement, and absolutely, you will get some questions questions about planes of motion and movement on the big test. So before going over planes of motion and movement, let's just go over some basic anatomical terms that you should know for the big test. So I'm going to read all of these over with you first, and then I'm going to show you what each one looks like. First up, we have superior, or towards the head of the body. Then we have inferior, and that's away from the head or lower. Then we have anterior, and that's the front side of the body. We have posterior, that's the back side of the body. We have medial, and that's towards the midline of the body. We have lateral, and that is away from the midline of the body. We have proximal, and that is nearest to the trunk or the point of origin. And we have distal, and that is farthest from the trunk or the point of origin. All right, so first up we have superior, or towards the head of the body. Basically, the higher something is up on your body, the more superior it is. So my neck is superior relative to my torso or my trunk because it is higher up or towards the head of my body. Inferior is the exact opposite, so the lower something is on my body, the more inferior it is. Essentially, my shoulder is inferior relative to my head because, again, it's lower down. Anterior is the front side of my body, so this is the anterior part of my body, my front side. And posterior, of course, is the exact opposite. That is the entire back side of my body. So medial will be towards the midline of the body, so if we pretend like there's a line going down the center of my body like that, the closer anything is to that line, the more medial it is. So my nose is medial relative to my ear because, again, it's closer to that midline of the body. And of course, lateral is the exact opposite. So my elbow is lateral relative to my sternum, for instance. Again, it is further away from the midline of the body. Proximal is nearest to the trunk or the point of origin, kind of similar to medial. So basically, the more proximal something is, the closer it is to the center of my body. So we could say that my shoulder is proximal relative to my elbow because, again, it is closer to the center part of my body. Distal is farthest from the trunk or the point of origin, so it's the exact opposite of proximal, like we just said. So my hand is distal relative to my elbow because, again, it's further away from the point of origin or the center of my body. Watch everything I just showed you a few times and make sure you understand all of that. So you definitely need to know there's 3 planes of motion and movement. You have the transverse plane, the frontal plane, and the sagittal plane. The transverse plane divides the body into top and bottom halves, so you can see top half here, bottom half here, and the transverse plane, this window plane looking thing, dividing this guy into top and bottom halves. The frontal plane, as the name would imply, divides the body into front and back halves. So this dude is being cut in half, and again, front half, back half behind this window pane right here. And then the sagittal plane divides the body into right and left halves, which you can see right here. So next up, we're talking about movements that occur in the sagittal plane. And like we just said, the sagittal plane is the one that divides the body into right and left halves. And there's a relatively easy way to remember which movements occur in that sagittal plane. Again, that divides the body into right and left halves. But first, I do need to teach you the movements themselves. So I'm going to read these guys off first, and then I'm going to show you what each one looks like. First up, we have flexion, and that is a decrease in the joint angle. We also have extension, and that is increasing the joint angle. We have dorsiflexion, and that is moving the top of the foot towards the shin, only applies to the ankle. And then we have plantar flexion, and this is moving the sole of the foot down towards the ground, and this only applies to the foot and the ankle. So essentially, as I'm doing this bicep curl type motion, you can see the joint angle here at my elbow is decreasing. So this joint angle is going down as I'm doing that motion. And again, this is elbow flexion because as I'm doing this motion right here, again, joint angle going down, flexion. So extension would be the exact opposite. As I'm going like this, and this joint angle is increasing, again, that's now extension because this joint angle is getting bigger. So going from this position to this position, extension. So again, anytime you see a joint angle decreasing like this, and it doesn't have to happen at the elbow, any joint in the body, you're dealing with flexion. Anytime the joint angle is increasing, that is extension. Now when it comes to dorsiflexion, essentially pretend that this part of my hand is my heel and these are my toes. I'm trying to keep my heel planted to the ground and then raise my toes up in the air. That is dorsiflexion. And plantar flexion would be the exact opposite. So if I'm just trying to keep my heel here and plant my toes down into the ground, kind of like a calf raise, that is plantar flexion. Probably gonna have to watch this over a few times, but all of these are definitely worth understanding and potentially memorizing. So how do you remember that things like flexion and extension happen in the sagittal plane? I have a trick for you. Going back to this picture and looking at the sagittal plane, again, it cuts this guy into left and right halves. And we can kind of see that this plane, or pane, really a window pane, whatever you want to call it, it comes out in front of him and it goes behind him. If we think about the movements that occur in the sagittal plane, we're thinking about like flexion and extension. They either go up or down, or they go forwards or backwards behind the body. So any exercise that goes up or down, or forwards or backwards behind the body, that is going to happen in the sagittal plane. This picture here also shows that movements in the sagittal plane, typically they have some forwards or backwards stuff going on. So bicep curls, tricep push downs, lunges moving forwards or backwards, squats. Again, these are all things happening in the sagittal plane. So now we're talking about movements in the frontal plane, and like we just said not too long ago, the frontal plane cuts the body into front and back halves. So in the frontal plane you have adduction, and this is movement toward the midline. We'll go over all of these in a second. You have abduction or abduction, and that is movement away from the midline of the body. You also have elevation and depression of the scapula. We don't really need to know these all that well. Something that might be worth looking up on your own time, but not super important for the test. We also have inversion and eversion of the foot happening in this frontal plane. So inversion turns the sole inwards toward the midline of the body. And we can see that here the sole of the foot is going inwards. Eversion is the opposite movement, which turns the sole outwards away from the midline of the body. Inversion, eversion, good to know, but not super important for the test. As far as adduction and abduction go, essentially abduction, so the second one here, abduction, is moving your arm away from the midline. So if I'm kind of lifting my arm up and out to the side like that, kind of like a lateral raise motion, again, that is abduction away from the midline. Now adduction is movement towards the midline. So if there's a midline of my body here, I'm adding my arm back to my body, and that's how you're going to remember this, adding my arm back to my body. That is adduction. You could do the same thing with your leg. If I had my leg out to the side and then I brought it back to my body, that would be adduction, because I'd be adding my leg back to my body. So now we're looking at the frontal plane, and again, it cuts this guy into front and back halves. We can kind of see this thing kind of moving out towards the right and the left of this person's body here. So if we look at that, we can kind of determine that the movements actually follow this plane as well. So this plane is moving to the right and the left, so the movements in the frontal plane are also going to move to the side or the right and left of the body. So whenever you see frontal plane, think about movements moving to the side of the body. And then we can see this here, movements in the frontal plane to the right and left side of the body. Last up, we're talking about the transverse plane, and this cuts the body into top and bottom halves. The transverse plane is probably the weirdest one. Again, the transverse plane cutting the body into top and bottom halves, and everything in the transverse plane has some element of rotation. So movements in the transverse plane. Rotation. When the torso or a limb moves around its vertical axis, we'll go over all of these more very soon. We have pronation, and that's rotating the forearm or foot to a palm side or foot side down position. We have supination, which is rotating the forearm or foot to a palm side or foot side up position. We have horizontal abduction, which is moving the upper arm away from the midline of the body when it is elevated to 90 degrees. We also have horizontal adduction, which is moving the upper arm towards the midline of the body when it's elevated to 90 degrees. All right, so rotation could be a ton of different things. If I'm doing a torso rotation move with like a cable or something like that, that would be an example of rotation. Pronation is this, rotating my hand to a palm side down position. So again, that motion right there is pronation. And then supination is the exact opposite. So if I'm going like this, and the best way to remember supination is cup of soup. I'm rotating my palms up, and I can hold a cup of soup here for supination. Remember that. Horizontal adduction is essentially me kind of moving like this, whether I'm throwing a punch. If I'm doing it on both sides, it's a fly motion. So a fly motion is horizontal adduction. And think about it this way. If it has adduction in there, I'm adding my arm back to the body or bringing my arm towards that midline. Again, the midline dividing my body into kind of halves here. And then horizontal abduction is the exact opposite motion. So I'm bringing my arms away from the midline of the body, and it could be like a reverse fly type motion. And like we see here with movements of the transverse plane, you kind of see this weird rotation-y guy. Yeah, if it has a rotational aspect to it, that movement is taking place in the transverse plane. So it's possible that you'll get a question or two where you'll be shown an exercise and you'll have to identify what movement is taking place. You will also have to identify what plane of motion the movement is occurring in. So if I'm doing some curls, squats, pull-ups, or rows, those are happening in the sagittal plane because, again, they're either going forwards, backwards, or up and down. Frontal plane exercises would be things like a lateral band walk, so that band walk side to side, or a lateral raise. And again, they're going to the right or the left of the body. And then some transverse plane exercise examples. Again, these all have a rotational component to them. So a torso rotation, wood chops, Russian twist. Just look for that rotational component. And finally, in this part 1 video, we are getting to exercise regressions, progressions, and form. You'll definitely be asked a few questions about a client doing an exercise and maybe they're screwing their form up in one way or another, and you are gonna have to correct it. Just like all the other questions on the test, these are multiple choice, so typically you're gonna be able to figure it out, but sometimes ISSA and the NCCPT will throw some tricky ones at you. Let's look at the lunge. Let's say I have a client lunging but they're wobbly. How should I regress the exercise? Should I A, allow the client to support themselves against the wall, B, decrease the number of reps that the client is doing, C, have the client do a backflip, or D, make sure you like the video? A lot of good answers here. I don't know. What do you guys think? The correct answer is A, allow the client to support themselves against the wall. If a client is lunging and they're wobbly, B makes some sense as well. A actually solves the problem though, so A is the better answer. Then there's usually going to be one answer that doesn't make a whole lot of sense, the backflip one. I don't know, guys. D also makes a lot of sense. Make sure you like the video. Let's say I have a beginner client lunging, they're doing great, and I need to make the exercise harder. How should I progress the exercise? Should I A, have the client do jumping lunges, B, tell the client to perform the movement faster, C, subscribe to the channel, or D, give the client light dumbbells to hold on to while doing the exercise? So if I'm trying to progress an exercise like the lunge or make it harder, jumping lunges would definitely do that, but it wouldn't be the first thing that I would go to, so not necessarily the best answer there. B, tell the client to perform the movement faster. Yeah, that's typically not the best thing to do either. C, subscribe to the channel. Now that's a good one right there. Make sure you subscribe. D, give the client light dumbbells to hold on to while doing the exercise. Yeah, that would be one of the first things that you would try when progressing a movement. Let's say I have a client who's squatting and leaning too far forward. Choose the best cueing advice to give this client. Should I A, tell the client their squat is a mess, B, tell the client to shift the weight back onto the ball of their foot, heels, and hips, C, hand the client light weights for increased stability, or D, stop the squat immediately and don't have the client do them anymore? So the best answer here is B, tell the client to shift the weight back onto the ball of their foot, heels, and hips. So A is very negative and mean sounding, which is always going to be wrong according to these organizations. And yeah, they're pretty much right about that. If a client's form is off or if they're unstable, yeah, you wouldn't really want to add weight to that, so C isn't a good answer. And then D is just a little bit excessive and a little bit negative. They wouldn't necessarily have to stop squatting immediately and not do it anymore. So yeah, B, definitely the answer to go with here. Next up, let's talk about agonists and antagonists. An agonist is the prime mover or muscle that does most of the work during a specific exercise. An antagonist is the muscle that opposes the agonist. The easiest example of this is the biceps and triceps. When I'm doing a biceps curl, the biceps are the agonist, meaning they're doing most of the work. The opposing muscle group, the triceps, would be the antagonist. So I'm going to grab this pen here and do some curls, and the main muscle doing most of the work in this motion right here is the biceps, and that would make the biceps the agonist, and the muscle on the opposite side that is opposing, that would be the triceps. So again, agonist for this motion right here, biceps, they're doing most of the work. Antagonist, triceps, they're on the opposite side of the body, which is going to be typical, and they oppose the action that we're doing. So if I'm doing a leg extension, what muscle group is the agonist and what muscle group is the antagonist? So the agonist in a leg extension would be the quadricep muscles. Again, those are the ones that are actually kicking those legs up there. And the antagonist muscles, which are on the opposite side of the leg, those would be the hamstring muscles because they are on the opposite side and they do the opposite motion. Let's look at a slightly more involved example. What is the agonist or prime mover of the exercise being shown, which is a Romanian deadlift or an RDL, and what is the antagonist muscle? So would the agonist be the hamstrings and the antagonist be the glutes, the agonist be gastrocnemius and the antagonist be tibialis anterior, the agonist be the hip flexors and the antagonist be the TFL, or the agonist be the hamstrings and the antagonist be the quads. So remember, the agonist is the muscle that is primarily responsible for doing the movement, and the antagonist is typically going to be on the opposite side of the body, and it's going to perform the opposite action. So in this case, D would be the best answer. In a Romanian deadlift, the hamstrings are doing most of the work. In the muscle group that does the opposite action and is on the opposite side of the leg, well, that's the quadriceps. So if you look at A, the agonist here is correct. The hamstrings are doing most of the work, but the glutes would not be an antagonist. They're actually helping the hamstrings do this movement. If we look at B, the gastrocnemius and tibialis anterior, these two muscles are actually antagonist and agonist to one another, but they just don't have all that much to do with a Romanian deadlift. And in this case, answer C is just wrong. I don't think we need to go into more detail on that one. You also have synergists, which assist prime movers or agonists with movements. So when I'm doing a bench press or a push-up, the prime mover there, or the muscle that's responsible for doing most of the work, is pec major. So the pec muscles are doing most of the work for a bench press or a push-up. That being said, deltoids, the triceps, you have a bunch of other muscles that are still helping out there, and those would be considered synergists. Reciprocal inhibition is related to everything we just talked about, the relaxation of muscles on one side of a joint to accommodate the contraction on the other side. We'll just keep going back to the biceps and triceps example because it's easy to show you guys. But again, if I'm doing a bicep curl, the biceps would be the agonist or the prime mover, the muscle doing the majority of the work. And then the muscles on the opposite side, the triceps, would be reciprocally inhibited. They can't really do much because they're being lengthened or stretched as I'm contracting the biceps. You also have autogenic inhibition, and this more has to do with foam rolling and things like that. This is the ability of a muscle to relax when it experiences a stretch or increased tension. So we have Golgi tendon organs and muscle spindles. You're probably going to get a question or two about these guys, and they're both very similar. So for the Golgi tendon organs, they are located at the point where the muscle and tendon meet. The GTO, Golgi tendon organ, is sensitive to change in muscle tension and the speed of tension change. The muscle spindles are sensory organs that lie parallel to muscle fibers. They detect muscle length and speed or rate at which a muscle is stretching. So they both essentially do the same thing. Muscle spindles are actually in the muscle itself and they lie parallel to the muscle fibers. That is key to know because you could get a multiple choice question that kind of gives you the location and then you have to determine which of these two things is the correct answer. So the GTOs are located at the point where the muscle and tendon meet, this musculo-tendinous junction, and again, that is not within the muscle itself. So that is in a separate area outside of the muscle, and again, they both pretty much do the same thing. They detect change in muscle tension and the speed of that tension change. Moving on to muscle contraction types, and this is something we've broken down a bit in this video already, but we're going to expand upon it a little bit more now, and of course we'll get into it more in the part 2 video as well. So first up we have static or isometric contractions. These contractions occur when there is no change in muscle length. So this dude doing a plank right here, he's not moving. He's just hanging out there, holding that move. That makes it an isometric contraction. No change in muscle length. A concentric contraction is when a muscle shortens, and an eccentric contraction is when a muscle lengthens. So let's break down concentric, eccentric, and isometric by looking at the bench press. So we're analyzing the bench press in these 3 different pictures. This is an eccentric path, so as this bar is moving down, pec major, which is the prime mover or the agonist for the bench press, that muscle is lengthening. So that would make this picture, because this bar is going downwards in this picture, that's going to make this part of the lift eccentric because again, pec major, the prime mover or the agonist, is lengthening. Now as the barbell is moving downwards, eventually you're going to hit the bottom and you're either going to be kind of touching your chest or maybe you're just very slightly above your chest. Either way, there is a tiny pause at the bottom of the lift, at least typically there would be. So at that pause, that very short pause at the bottom, that is going to be isometric because the bar at that point in time isn't moving. So the bar is still, again, it's for a very short period of time, but bar isn't moving, isometric at the bottom. It's also isometric very briefly at the top of the lift because the bar isn't moving. Because nothing is moving, the muscle length is staying the same. So think of like a plank. That's a totally isometric exercise. In most lifts, there might just be a small isometric part. Again, the bottom of the bench press, if you're pausing down there for a second or a fraction of a second, that tiny fraction is going to be isometric because no muscle length changes are taking place. Now what about as you're pushing that barbell back up? Look at this dude. He's kind of struggling to push that barbell back up. So as you're pushing the barbell back up in a bench press, that is a concentric movement because your pec muscles, the prime mover, the agonist in this lift, they're shortening. So your pec muscles are shortening. They're kind of getting closer together. They're getting all bunched up. And because of that, this part is a concentric part of the lift. Muscle lengthening on the way down, eccentric, we have a slight pause at the bottom, so no lengthening or shortening is happening. So that would be isometric at the bottom and at the very top of the bench press for a very short period of time. And then as that bar is getting pushed up from the bottom, that is concentric, again, because the pec muscles are shortening on the way up. Review all that a few times, make sure it makes sense. So periodization is a systematic planning of physical training. The aim is to reach the best possible performance for a specific time frame or event. You achieve this by changing up exercise variables when appropriate. And some exercise variables that exist are sets, reps, time under tension. Of course, there are other things too. So for breaking down a periodized plan, an entire periodized plan is a macrocycle, and it can last up to a year or so. A mesocycle is a specific block of training to achieve a specific goal, and typically they're about a month long. And then a microcycle is the smallest, typically they're just about a week. So linear periodization is the most basic type of periodization, and it's a traditional method of program design that aims to gradually increase the intensity of the training load while simultaneously decreasing volume over a set period of time. Next up, we have undulating periodization, and this is a program scheme also known as nonlinear periodization, and it uses changes in volume, intensity, and exercise selection to provide loading differences on a daily or weekly basis. Daily undulating periodization is often known as a DUP or DUP program. So basically know that linear periodization is a gradual increase of intensity and decrease of reps, and nonlinear or undulating is more all over the place. So the weight or resistance might look like this. In linear periodization, it's going slowly up over time, and it would generally go up in undulating periodization as well, but it wouldn't be that same steady increase. So next up, we're moving on to the 5 components of fitness. We have cardiovascular endurance, muscular strength, muscular endurance, flexibility, and body composition. These are pretty much what they sound like. Cardiovascular endurance, how long can you sustain cardio exercise, running, cycling, etc. Muscular strength, how much can you lift? Muscular endurance, that's more like the push-up assessment that we'll talk about soon enough. Flexibility, body composition, yeah, they're pretty straightforward, and they are good to know. So now we have essential elements of a fitness program. First off, you have the warm-up, and then you have general or specific ones. General warm-up would just be like jumping jacks, maybe some bodyweight squats. It's not really specific to the event that you're about to be doing. If you were training a basketball player and they're getting warmed up for a basketball game, maybe some jumping exercises would be a little bit more specific. Flexibility training, that's another part. Core training, that's really the midsection, of course. Balance training, reactive training, which is more a client or an athlete reacting to certain things. So if I'm passing a medicine ball to someone, that's reactive training. A lot of jump training would kind of fall into that as well. Plyometrics, resistance training, that's just typical weight training. Cardio training, so that is going to be a client doing cardio exercise, whether it's on a treadmill, on the field, you name it. And then of course we have the cool down as well. Are these worth memorizing? No, I think you just look these over a few times. You're going to know them well enough for the test. So we have the acute variables of fitness. We have the type, so basically what kind of exercise are you doing, exercise selection, exercise order, intensity, sets, reps, frequency, how many times are you training throughout the week, range of motion or ROM, time, how long are you training for, tempo. If I'm training someone to do a bench press and we're going 2 seconds on the way down for the eccentric portion where the muscles, the prime mover is lengthening, and then 1 second on the way back up for the concentric portion, that would be tempo. Time under tension, kind of similar to tempo, but it's more just like the total time under tension. These are just good to look over, certainly not worth memorizing. Look them over a few times, you'll know them well enough. Moving on to reactive training, quick and powerful movements that utilize a rapid stretch shortening cycle. We're going to talk about that a little bit more later in this video, and that's to enhance power, speed, neuromuscular efficiency. These exercises, which include techniques like plyometrics, jump training, train the body to respond explosively to predictable and unpredictable demands, improving agility and quickness. So again, if I have a client jumping onto a box, to some extent that's reactive training. If I am throwing a tennis ball at a client and then they have to kind of squat down and catch it real quick, again, that's reactive training. So a lot of this stuff is sport specific or jump training. Of course, there are other variations here, but typically that's what you're looking at. Next up, we have HIIT or high intensity interval training. And this is when you alternate short, very intense bursts of exercise with rest or recovery periods at a low intensity. The intense intervals are typically done at 80% to 90% of an individual's maximum heart rate. So for true high-intensity interval training, HIIT, as it's commonly known, this person is working really hard for those short, intense bursts. Again, that's why they have to rest and recover after that, because you're working so hard, and it is for a short period of time. Usually you're dealing with like 30 seconds, 40 seconds at max. Short burst of intense, and then you have rest after that, and you're alternating. That is HIIT. Next up, we have exercise order. And essentially, if you're doing a session with a client, this is the order of exercises or the order that you would do them in. So power exercises, things like the snatch, push, press, plyometrics, jumping things, really explosive things. Typically, you would do those first. Compound lifts, bench press, squat, deadlift, etc. Those would come right after the power exercises. And sometimes there's debate between which of these two you would do first. Most resources are going to say power exercises, and then accessory would come third. These are single joint, much simpler moves. Curls, crunches, lateral raise. Most core work, honestly, would go in here. This one is good to look over and good to know. So we have 4 different rep ranges that we have to think about here. We have muscular endurance, hypertrophy, muscular strength, and muscular power. Definitely good to know these, and these are pretty basic goals that you'd be working on with a client, and it's good to kind of cycle between these different rep ranges regardless of who you're working with. So look them over a few times. So for muscular endurance, typically you would be doing 15 or more reps, 1 to 3 sets. The intensity would be 67%, 1 rep max. This is an estimate. It doesn't have to be exactly there, but it should be right around there. And then the person will be resting 30 to 60 seconds between exercises or between sets of the same exercise. So this is for muscular endurance. These are just good to have a general idea of. You don't need to memorize them. So if we have a client focused on hypertrophy, hypertrophy is muscle growth. ISSA and the NCCPT, they recommend 6 to 12 reps, 3 to 4 sets. The intensity should be 67 to 85%, 1 rep max. And again, we're looking at the same rest, 30 to 60 seconds between exercises. That's if we're working with a client who's focused on hypertrophy or muscle building recommendations. Again, don't have to memorize them. From there, we're talking about maximum strength or just strength, whatever. Anyways, for reps, we're looking at 1 to 6 because now we're working at a much higher intensity. 85%, 1 rep max. So this is for people who are focused on strength. For sets, we're looking at 3 to 5, and then the rest between exercises or the rest between sets, 2 to 5 minutes, and that's just because we are working at a higher intensity. Next up, we're talking about power exercises. These are more explosive. Oftentimes, they're jumping exercises or Olympic lifts or something like that. For reps, we got 1 to 5. Sets, we have 3 to 5. The intensity is high here, so 75 to 90%, 1 rep max. And then for rest, it's 1 to 2 minutes between exercises. Not worth memorizing any of these different rep ranges for power, strength, muscular endurance, etc. but just good to look them all over and understand them. Next up, we're talking about progressive overload. This is the gradual increase of stress on the body during exercise to continually challenge muscles and drive physical adaptation such as growth and increased strength. So if I'm doing a ton of bicep curls and my biceps get way stronger, that is happening because I'm putting on some muscle mass there, and that is progressive overload. I'm building muscle mass because I am damaging my biceps and rebuilding them back stronger. You really need to know what progressive overload is. It's the thing that allows us to become stronger over time by building muscle mass primarily, but there's other things that this could apply to as well. This is another one that you should probably just know. FIT, so the FIT principle is frequency, so how often are you working out throughout the week? Intensity, how intense are you working out? At what percent of your 1 rep max? Could apply to a few other things here as well. What type of exercise are you doing? Are you doing weight training? Are you doing cardio, flexibility, etc.? Time, so how long are you working out for? Make sure you know this. Simple, but very good to know what it is. So next we're moving on to types of flexibility training. We have static, we have dynamic, we have SMR, self-myofascial release, we have ballistic, and we have PNF. So static stretches are when you're holding a stretch. So if I'm just doing like a basic quad stretch where I'm grabbing my foot, just holding that stretch for 30 to 60 seconds, that would be a static stretch. Dynamic stretches, typically you're kind of moving around a little bit more. So we're talking things like jumping jacks, arm circles, toe touches. They're not super spastic, but they're coordinated movements through full range of motion. SMR, self-myofascial release, if I'm laying on a foam roller, kind of rolling around, trying to loosen up some spots. You can also use a lacrosse ball, etc. Ballistic stretches, these are bouncy. We're talking like really aggressive leg swings, things like that. Usually they're not so good for the average person. Not always true, but typically they're kind of frowned upon, so keep that in mind. Lastly, we have PNF stretches. These typically use a partner, and if I'm stretching out a person's hamstrings and I have them kind of push their leg into me for a second, and then I'm kind of trying to stretch them a little bit further past that point after that, that is the contract relax, and it's an effective way to increase or improve someone's mobility. So yep, again, typically involves a partner for PNF. This one is good to look over. So here's a question. What is the right amount of time for a warm-up? The answer is typically 10 to 15 minutes, not always the case, but usually. Another question, what do you do for hold, relax, or contract, relax stretches? So the answer, contract these stretch muscles for 5 seconds, release, find new range of motion. Typically, you can kind of push them a little bit further once you've done this kind of contract and then stretch for 5 seconds. And you're going to repeat that 1 to 4 times. And again, this is a really good way to help someone improve their flexibility. So next up, we have cardio recommendations. For fat loss, 150 minutes to 2.5 hours a week of moderate intensity cardio. For someone who's more focused on strength and hypertrophy, 75 minutes of vigorous intensity cardio weekly. General fitness, you could just do a combination of both. Again, this one is not worth memorizing whatsoever. This fat loss one here is probably pretty good to know though. 150 minutes to 2.5 hours, 2.5 hours a week of moderate intensity cardio. Yeah, I think that range there is probably pretty likely to come up one form or another on the test. So now we have some more cardio recommendations. For youths or kids ages 3 to 5, they should just be active generally. And kids who are 6 to 17 should do 60 minutes of activity daily with 3 days a week of vigorous stuff too. So vigorous stuff could be maybe they're on the soccer team and they're kind of getting out there and sprinting around a little bit more. But generally speaking, they should just be outside or even inside, moving around, doing some general activity. So good to know, 60 minutes daily, 6 to 17 years old. That's what we're looking at with some vigorous stuff in there too. So now we're talking about some more cardio stuff. First up, we have LISS, low intensity, steady state cardio, 60 to 70% heart rate intensity, so it's slow and steady. Moderate intensity, we're looking at 70 to 85%. And then HIIT, we already talked about HIIT. That's where you're going between very intense and then rest, and you're just kind of bouncing back and forth between those two things. Good to look these over a few times. Not insanely important to know these percentages though. Essentially, you should know that 150 minutes weekly is the moderate intensity recommendation. So if someone's doing moderate intensity cardio, 150 minutes weekly is what you're looking for. Know that 75 minutes weekly is the vigorous intensity recommendation. So if someone's doing high intensity interval training or something really intense, 75 minutes weekly is the recommendation for that vigorous intensity when we're talking about cardio. And then you can also just do a combination of both, and that's going to work really well for some people. But just know 150 minutes weekly for moderate intensity, 75 minutes weekly for vigorous intensity. Those are your cardio recommendations. So here's an example. This could look like 30 minutes of moderate exercise 5 days a week. That gets you the 150 minutes weekly of moderate exercise, or 25 minutes of vigorous activity 3 days a week, which would get you the 75 minutes of vigorous. You could also do a combination of both. Moving on to the law of reversibility or detraining. 3 to 4 weeks of inactivity causes this: muscle atrophy, which is essentially when your muscles are shrinking, loss of flexibility, so you're becoming less flexible, loss of strength, etc. And that can all happen in a pretty short period of time. 3 to 4 weeks of inactivity causes this. So yes, that would be the law of reversibility or detraining. So we have 6 fundamental movements according to ISSA and NCCPT. The hinge would be something like a deadlift, so a hip hinge, pushing, bench press, push-ups, overhead press, pulling. That could be like a row or a chin up or a pull down or any of those types of things. Squatting, you guys know what squats are. Lunging, hopefully you know what lunges are. And locomotion, which is movement from one place to another. Walking, running, those would be, the obvious locomotion choices. Look all of these guys over a few times. Make sure you know what they are. Next up, we have RPE, or rating of perceived exertion. So you can rank things on a 1 to 10 scale, which I feel like that one's pretty self-explanatory. 10 is hard, 1 is super easy. And then you can also rank things on the Borg scale, in which case 6 is very easy and 20 is very, very hard. And you should definitely know and understand all of that. So now we're moving on to pre-participation health screening. And as you might have guessed, there are some forms here that we have to focus on. First up, we have the PAR-Q, and this is a subjective yes or no questionnaire that is used to determine whether it's safe or not for a client to begin an exercise program. It does have some follow-up portions to reduce false positive readings. And again, the most important things for you to know here, it's yes or no. And again, there are some additional portions. So yeah, all good things for you to either memorize or know very well. Now we're talking about the health history questionnaire, also called the HHQ, or the health history evaluation. It has a few different names. It's pretty similar to the PAR-Q, but it's not yes or no questions. It gets you more detailed information on your client. Things like what medications they're taking, family history, etc. are covered. So the informed consent is an important one for you to know. This gives clients information about the content and the process of the program that you're going to be delivering. So some essential elements or things that you would find in the informed consent are a detailed description of the program, the risks and benefits of the program, a confidentiality clause, responsibilities of the client or participant, and documentation or acceptance of the form itself. So a few reasons to refer out to a doctor. So let's say someone's coming in, they want to exercise with you, but you're like, you got a few things going on there, buddy. I'm not sure we can start exercising quite yet. You might want to get clearance if there are cardiovascular disease risks or signs. So if someone's filling out the PAR-Q and they're hitting yes in a few things there, well, you might want to refer them out to a doctor before you start training them. Musculoskeletal injuries, yeah, let's just say someone has a bad back injury or a bad shoulder injury or whatever. That might be a reason to refer them to a doctor before you start training them. Diabetes, low functional capacity. Let's say they get winded just getting up and down from a chair. Like we're talking really winded to the point where you're like, I don't even know if this person can work out at all. Any of these things, yes, these would be reasons to get a letter of clearance before starting to train them. So good to look these over a few times. Also, when it comes to exercise readiness, we have the Transtheoretical model. And this is something you're very likely to get at least one question about. By the way, there are 5 stages to the Transtheoretical model. So those 5 stages are pre-contemplation, contemplation, preparation, action, and maintenance. First up, pre-contemplation, and this is where people are physically inactive. They're not intending on beginning an exercise program, and they don't see exercise as worth their time. After pre-contemplation, you have contemplation, which I feel like makes sense. Here, people are inactive, but thinking about becoming more active in the next 6 months. They're still weighing the pros and cons of exercise, but they're starting to consider the benefits. After contemplation is preparation. People in this stage are doing some physical activity and preparing to adopt a more consistent activity program. These people are only doing things like sporadic walking, but they're ready to adopt an active lifestyle. After preparation, you have the action stage. People are here when they're engaging in regular physical activity, but have been doing so for less than 6 months. So remember that, less than 6 months if they've been doing physical activity. Action stage. Lastly, you have maintenance. Should say people in this stage, not on this stage. Anyway, people in this stage have been working out consistently for longer than 6 months, and just make sure you can identify where someone is in this model. So if I have a client and they've been working out consistently, but just for 2 months, technically they would go in this action stage because, again, they haven't been doing it for at least 6 months. And then, of course, if I have someone who isn't thinking about working out at all, they'd go in this pre-contemplation stage. Next up, we're getting into assessments, and we have quite a bit to discuss here, and a lot of this stuff is pretty important. So we have subjective assessments, we have objective assessments. Subjective assessments are opinion and observation based. So if we have a client filling out a PAR-Q and they're giving us a bunch of yes or no answers to questions, they're pretty much giving us their opinion on whether or not they have something going on. Objective assessments are measurable, repeatable, or easy to replicate. So if we did a push-up test with a client, well, it's measurable. We can measure how many push-ups they're doing. It's repeatable. It's easy to replicate. Same with taking someone's blood pressure. That is definitely objective because it's giving you real information that we can test for. Subjective things, typically more observation or opinion based. Reliability is a measure of repeatability or consistency of a test or observation. So if I take someone's blood pressure 5 times, it's a pretty reliable test. If I'm good at taking someone's blood pressure, I should get a pretty similar reading every time. Validity, the test measures what it's supposed to measure. Blood pressure test does measure someone's blood pressure. Push-up test measures muscular endurance, how many push-ups someone can do. But a push-up test would not be a good test for measuring maximal strength, right? So you have to think about, is the test valid for what we're trying to use it for? So taking a client's heart rate, typically their heart rate is going to be 60 to 80 beats per minute. You have bradycardia, and that's a very slow heart rate, which would be under 60 BPM or beats per minute. There's also tachycardia, which is the exact opposite. That's a heart rate that is high, so over 100 BPM. So there's a few different ways you can take someone's heart rate. You have the brachial artery, you have the radial artery. This is really the one that we're going to be using the most, and that's kind of why I have its location down here. So it's the lateral wrist, beneath the base of the thumb, the carotid artery, that's your neck, got the temporal artery. Don't really need to know too much about these. Again, the radial artery, I would memorize that one's location because that's the one we use the most often. And you can get someone's heart rate in a bunch of different ways. So if you take someone's heart rate or kind of listen to their heartbeat for 6 seconds, you can multiply that number by 10. But there's a bunch of different ways you could do this. You could get their heart rate for 10 seconds and then multiply that number by 6. Doesn't really matter. You can use whatever mathematical formula floats your boat. Normal blood pressure would be where your systolic, that top number, is less than 120, and that diastolic number, that would be the bottom number, that's going to be less than 80. That would be normal blood pressure or not a risk. Then you have elevated blood pressure, and this person isn't at risk yet, but they are well on their way, and their systolic number, that top number, is going to be 120 to 129. And again, their diastolic number would still be under 80. Then you have stage 1 hypertension, and you can see the numbers there for that. Stage 2 hypertension, and again, you can see the numbers there for that. And then you have a hypertension crisis. So this is like where someone's blood pressure is very dangerously high. And again, you can see numbers here for this. Should you memorize these numbers? Probably not. Again, it's good to know them, but probably not worth memorizing. When it comes to cholesterol, you have LDL and HDL. LDL is often known as bad cholesterol and HDL is good cholesterol. Because of that, if someone has an HDL greater than or equal to 60, it is a negative risk factor, so technically it would subtract a risk factor from their overall list of risk factors. BMI or body mass index, this is an interesting one. So you have two different formulas you can use here to calculate someone's BMI, and that is something that you might actually have to do on the big test. Personally, I like this bottom formula more, and that's because you don't have to worry about meters or anything like that. So again, this bottom formula is usually my go-to, and you can see I actually plugged my information into this equation down here. So 703 times 180, I weigh 180 pounds. I am 5'10", so 70 inches squared. And then if we multiply these two numbers together and divide that number by the square root of 70, we get 25.82, and that would be my BMI. And I'm not saying like I'm some physical specimen or something like that, but this is me just a few months ago. I look the same now. And yeah, I'm clearly in at least halfway decent shape and not overweight. And that is the thing you need to know about BMI. BMI doesn't take body fat percentage into consideration at all. BMI is all about your height and your weight, and that's it. So if you're someone who has a lot of muscle mass, like The Rock, for instance, you're almost certainly going to end up in this obesity category, which again, we all know The Rock isn't actually obese. He has a ton of muscle mass on his frame and incredibly low body fat. So BMI is kind of one of those weird things. But again, you might need to calculate someone's BMI on the big test. I don't necessarily think you need to memorize these numbers, but there are a few important ones here. So if someone has a BMI under 18.5, they're considered underweight. If their BMI is between 18.5 and 24.9, they're in the healthy range. If it's between 25 and 29.9, they're considered overweight. If it's between 30 and 39.9, they are obese. And if it's 40 or over, they are severely obese. I would memorize that 30 and over means they're obese. I would memorize that 25 to 29.9 means they're overweight. And I would also memorize that 18.5 and under is underweight. And then if you kind of know those pieces of information, you can figure everything else out. Moving on to skin fold, and basically this is where we are using one of these calipers to get measurements of someone's estimated body fat percentage. We always want to do this on the right side of the body, and usually we are taking these measurements 3 times in each area. And the sites that are listed up here, the abdominal, triceps, chest, pecs, mid-axillary, subscapular, suprailiac, and thigh, we don't have to memorize really any of this information, but these are the ones that ISSA and NCCPT most often recommend. Bioelectrical impedance is an interesting one. Basically, if you have one of those scales or one of those handheld things that's telling you your body fat percentage, it is using a technology called bioelectrical impedance, or BIA. So the way it works is it basically determines your body composition based on the rate at which an electrical current travels through the body. Body fat or adipose tissue causes greater resistance, impedance, than fat-free mass, and slows the rate at which the current travels. It does require specific testing arrangements. And a lot of this just comes down to hydration. If someone is dehydrated, they're going to show up as fatter than they actually are. If someone is overhydrated, they're going to show up as leaner than they actually are. So we have some more bioelectrical impedance or BIA stuff. Don't eat or drink within 4 hours of the test. No exercise within 12 hours of the test. No alcohol within 48 hours of the test. No diuretics within 7 days of the test. Don't test females retaining water due to their cycle. Tell clients to pee 30 minutes before the test. None of this stuff is worth memorizing, but look it over once or twice. This is all relevant because bioelectrical impedance definitely relies upon someone being hydrated for things to be accurate. So next up, we're looking at some body fat percentage numbers. None of this stuff is worth memorizing. I think it is good to have an idea of these numbers, though. You could be asked a question about it. So we have women, we have men. Lower essential body fat for women, 10 to 12%. For men, it's 4 to 6%. Athletic for women, 13 to 20%. For men, it is 7 to 10%. Fit for women, 21 to 24%. Fit for men, 11 to 16%. Average for women, 25 to 31%, average for men, 17 to 25%, overweight, 32% or 32 plus, and then overweight for men, 26% plus. So good to look these numbers over. You could be given a question about it. You could be given a guy who's like, I don't know, 10% body fat, and then you have to kind of figure out where he would be in this range. He would be in the upper end of athletic. It's unlikely that you're going to get something that specific, but it is good to have a general idea. And we need body fat to, help with things like hormone production. So we do need some level of body fat within our bodies. However, if you have too much body fat, obviously that can cause problems. So yeah, good for you to know all of that stuff. Speaking of things not worth memorizing, these are circumference measurement spots to think about. These are some of the ones that ISSA and the NCCPT recommends. We got the hips, so the widest portion of the hips, that would be a spot where you would do a circumference measurement. The neck, the upper arm, which would be like the bicep. We have mid-thigh. We have the waist or the belly button, and we have the forearm. And you'd be kind of measuring all of these spots if someone was really focused on weight loss and kind of seeing their inches or circumference measurements change over time. Should you look these over once or twice? Yeah, circumference measurements are good to know. Are they very likely to appear on the test? No, not that likely. Next up, we are talking about somatotypes. Now, these are kind of controversial, but ISSA and NCCPT do actually kind of have some information in the text on these, and I've heard of somatotypes popping up on the test. So yeah, we'll go over it real quick. Ectomorphic people are skinny and they find it tougher to gain mass. Mesomorphs, these are people who naturally have just a bit of a more athletic or muscular build. They put on muscle easier. And then you have endomorphs, and typically they put on mass easier as well, but it's more so fat. It is muscle too. And it's tougher for them to lose weight. So it is good to have a general idea of what an ectomorph is. Someone skinny, a hard gainer would be the bro term there. Mesomorph, they just put on muscle mass easy, so they get kind of a nice deal there. And then endomorphs put on mass easier as well, but oftentimes it's not just muscle, it's also fat, kind of big and blocky looking, some of these people, and it's tougher for them to lose weight. So we have VO2 max. This is the most valid measurement of aerobic fitness. It's also known as maximal oxygen uptake or peak VO2. This is not something that will be done with typical clients, and that's because you kind of need like a testing center and a bunch of high-end equipment to pull this off, but it's good to know what VO2 max is. It is the most valid measurement of aerobic fitness. You're in there, you got a mask on, and you're breathing into this device as you're on a treadmill or a bike, and it's giving you some useful information if you're an athlete. Onto the kinetic chain checkpoints. These are spots you'd be looking at when doing an assessment. So we got the feet and ankles, we got the knees, we got the hips, the shoulders, the spine, and the head and neck. Should we memorize all of these spots, all of these kinetic chain checkpoints? No, we should not, but we should look them over a few times. Feet and ankles, knees, hips, shoulders, spine, head and neck. These are the spots we're thinking about for ISSA, for the NCCPT. These are the spots we're generally looking at for assessments. Not always true, but very often the case. So we have the box drill. This is an agility test. It includes sprinting, backpedaling, and side shuffling to cones. Just have a rough idea of what it is. Not super important to know any of these assessments very well. Moving on to the 1.5 mile run test. This is best for fitter clients, which makes a lot of sense. You wouldn't want to have someone who's totally out of shape trying to run 1.5 miles. It estimates aerobic fitness levels by scoring the individual's timed performance or their heart rate response, which is used to estimate VO2 max. Good to know that this one can help you estimate VO2 max. Next up, we have the Rockport walk test, and this is a 1 mile walking test also to predict VO2 max. Since this one is walking and not running, it is appropriate for new exercisers, which is good to know. It's likely not going to work as well for fit individuals though, and it can be done on a treadmill, which you can see right over here. By the way, someone's mile time and heart rate are what are used to predict the actual VO2 max here. Next up, we have the YMCA 3-minute step test, and that is 3 minutes of stepping on a 12-inch step to a 96 step per minute cadence. So after 3 minutes, you're going to take someone's pulse within 5 5 seconds post-test to determine aerobic fitness. And this one is possibly good for deconditioned clients, and that's because it's not terribly difficult. Still a 12-inch step though, and it could be too difficult for some people, so this is one you're going to have to think about if it shows up on the test. Next up, we have the 12-minute run/walk. It's designed to measure the distance traveled over 12 minutes, and that's again why there's a combination potentially here of running and walking. This determines a VO2 max estimate based on a chart, so you're going to have to go into the book to actually kind of see where somebody ranks, and this is typically done on a track. In fact, it's always supposed to be done on a track. Moving on to the push-up test, it can be done full or kneeling. Typically, men are going to do it full or just regular push-ups. Women will do it kneeling. This measures muscular endurance for the upper body because you're doing as many push-ups as you can in 60 seconds, and that's what's counted. So yeah, typically if someone's fairly fit, they're going to be doing a good number of push-ups here. On to bench press and leg press, and of course these are for measuring strength. Usually they're done for multiple reps, and then a 1 rep max is estimated using a chart in the book typically. A 1 rep max can actually be tested for, so you're just doing 1 rep with as much weight as you can. Usually a little bit more risky, not something you would do with the average client, but it is possible to do. Anyways, when in doubt, don't do these assessments with people. 5 rep maxes, 10 rep maxes, 1 rep maxes. When in doubt, don't do them with people. Typically, we're not going to want to have clients do the Valsalva maneuver, and that is when they're breathing out strongly through their mouth while holding their nose tightly closed. This creates a forceful strain that can trigger your heart to react and go back into normal rhythm. It can potentially allow you to lift a teensy tiny bit more, but it can raise blood pressure. Yeah, Valsalva maneuver for our clients, not so good. So this is definitely something to remember, pops up on tests pretty often. So now we're talking about posture, and typically you're going to be observing posture from the front and the side, and you're going to want to do it static where people are kind of just standing still. And then you're going to want people moving around a little bit too, just to kind of see how their posture changes as they're moving. Now for ISSA and the NCCPT, posture isn't massively important. So we do have a few things here that it is good to know though. So this is a scoliosis posture, and that is a lateral or sideways deviation of the spine. Just good to know what it is. We have a overly lordotic posture. We are going to break these down a little bit more in a sec. That is when this curve in the low back, which we all do have a little bit of a curve in our low back, but if that curve becomes too great, that does cause some problems potentially. We have a kyphotic posture. This is a rounded or kind of hunchbacky looking posture. Same thing as lordotic, except now the curve is happening in our upper back. We are supposed to have a small curve up there, but if that curve gets too great, people get really hunched over. It can cause some biomechanical problems, not so good. Sway back and flat back, we really don't need to talk about too much, but they're good to just kind of see here as well. Anyways, if the hip flexors and lumbar extensors are too tight and short, you could end up kind of with this overly lordotic posture right here. We're all supposed to have a curve in our low back here that goes inwards, but this person's curve is a little too big, and that can have some negative consequences. Don't memorize all this stuff, but it's good to just have a general idea of what's going on here. So a kyphotic posture is this overly rounded forward posture, and again, you can see that right here. So basically what's happening there is the interior chest and shoulder muscles, lats, and neck extensors are too tight and shortened. And again, this one makes sense. If everything on this front side here is too tight and shortened, I'm gonna be kind of just like stuck in this position like this. Again, that's what someone with kyphosis has going on. These guys right here on the front side, too tight, too shortened. So if we already said that these muscles on the front side are too tight and shortened, these muscles back here that are on the opposite side of the body, they're going to be overly lengthened, stretched, and weak, and that should make sense based on some of the stuff that we talked about earlier in this video. So when it comes to posture, we also have to think about what's happening with the knees. We have a normal knee alignment here where it's a pretty straight line down. Knee varus, where the knees kind of bow outwards if someone is just standing there. Typically, you're going to see it more if someone is doing a squat or something along those lines. And then you have knee valgus, which is where those knees kind of cave inwards. Really obvious to see when someone is squatting, whether they have issues with knee valgus. So good to have an idea of what each of these things are. Normal is over here. knee varus, too far out to the sides. Even more common than that is knee valgus, and knee valgus is definitely an issue if it's happening when someone is squatting. All right, so now we're moving on to the nutrition section of the study guide, and as you might expect, there is some important information in this part. All right, so let's kick this off by saying that we are personal trainers, not dietitians. We don't develop meal plans for clients. We don't do medical nutrition therapy. That being said, we can do things like help our clients to understand food labels, what certain nutrients do in the body, etc. Also, we can use the dietary guidelines developed by the government and the recommendations from myplate.gov. If there is a question about what you can legally do as a personal trainer nutrition-wise, the answer most often will have to do with the US dietary guidelines or myplate.gov. Also, it won't be uncommon for a question to come up where the best thing for you to do would be to refer the client to a registered dietitian. For example, if a client has diabetes and they want to lose weight, even if it's something that you could help them with, the correct thing to do would be to refer them to a dietitian. So anyways, moving right along now, there are 6 basic nutrients. We have carbohydrates, proteins, fats, vitamins, minerals, and water. Keep that in mind. These are the 6 basic nutrients. And one thing you definitely need to memorize is that 1 gram of protein is 4 calories, 1 gram of carbohydrate is 4 calories, and 1 gram of fat is 9 calories. Like I just said, make sure to memorize this piece of information. So you have micronutrients. Micronutrients would be things like vitamins, minerals, and phytonutrients, which come from plants. You have complete proteins, and these provide all the essential amino acids. Animal and dairy proteins fall into this category. You also have incomplete proteins, and these are missing 1 or more amino acids. Plant proteins fall into this category. Moving on to some protein recommendations. 0.66, sometimes up to 0.8 grams per kilogram of body weight is recommended for sedentary people when we're talking about protein recommendations. And the 0.8 grams per kilogram of body weight is underlined here because that is really the number here to know. That is the protein recommendation, 0.8 grams per kilogram of body weight for sedentary people. Just keep that one in mind. That is the most commonly asked about one. So if you're going to get a question, very likely that this could be the answer. For more active people, 0.9 all the way up to 2 grams per kilogram is advisable. If someone is lifting weights a lot or they're some kind of crazy athlete, they might need more protein, so it is good to know that. We also have carbohydrate recommendations. 45 to 65% of daily calories should be carbs. And if someone is focused on weight loss, 25 to 40% is possibly better. This number here is definitely good to know, though. Could pop up on the test. 45 to 65% of daily calories should be carbs unless specified otherwise. Onto fat recommendations. Third here, protein, carbs, and fats are the 3 macronutrients. 20 to 35% of daily calories should be from fat. 20% could be better for people who are focused on weight loss. So might want to be towards the lower part of this range if someone is focused on weight loss. Yeah, definitely good to know and potentially worth memorizing as well. So we got a whole bunch of different types of fats here. We have monounsaturated fats. These are heart healthy. Some examples are olive oil, avocado, peanuts. You also have polyunsaturated fats or omega-3s. These are also heart healthy, and you can get those from fish, flax seeds, and some dairy will actually have some as well. There's also polyunsaturated fats, and those are omega-6s, and these are essential for growth and development, vegetable oil, nuts, and seeds. You also have saturated fats, and these are always a little bit controversial. Health benefits are unclear. You do want to limit consumption. Animal fat, full fat dairy, and coconut would be examples here. Trans fats are no good. Typically they're artificial or created in like a lab or something along those lines. Yeah, they're bad, so just keep that in mind too. There is 3,500 calories in a pound of fat, and a 500 calorie deficit would get you roughly a pound of fat loss every week. Some good quick information on this slide here, and some of this could definitely appear in your final test. So some fat soluble vitamins, you have A, D, E, and K. These vitamins are stored in fat in your body, which means you can actually overdose on these vitamins here. So A, D, E, and K. Keep that in mind. There's also water-soluble vitamins, and these ones are not stored in fat cells in the body, so you tend to just pee out any excess of these guys. and that would be vitamin C and the B vitamins. So the major minerals are calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Probably don't need to memorize that one. These other two are pretty important though. You have monosaccharides. These guys are simple and can't be broken down. Glucose, fructose, and galactose would be examples there. Probably not worth memorizing, but good for me to tell you either way. Could pop up on the test. Same goes for disaccharides, and these are two monosaccharides joined together. Sucrose, maltose, and lactose would be examples there. Then you have polysaccharides, and these are long chains of glucose units. Glycogen, fiber, and starch are examples there. So now we are talking about hydration. 91 to 125 ounces of water per day. 91 is typically women, 125 is typically men. This is 2.7 to 3.7 liters. And again, we're talking about hydration, so how much water should you be drinking? So 4 hours before exercise, you want to drink 5 to 7 milliliters of fluid per kilogram of body weight. So you'd have to do some math to figure that out, but not really worth going crazy. Just good to have general ideas of these numbers. Not really necessary to memorize or anything like that. General exercise, drink 250 milliliters, which is about 8 ounces, of fluid every 15 minutes while the person is exercising. Drink 24 ounces of fluid for every pound of body weight lost during exercise. You're just trying to replace the amount of sweat lost with fluids. Yeah, it's good to look these numbers over a few times. Probably not worth memorizing. Moving on to the glycemic index, we have low, medium, and high glycemic index foods. And essentially, low glycemic index foods, they don't affect your blood sugar as much. So foods that release glucose slowly into the bloodstream. And these would be things that are typically lower in sugars, carbohydrates. Peanuts would be an example. Only has a glycemic index of 13. We have medium GI foods. And again, these are foods that raise blood sugar levels moderately. Actually, Raisin Bran, which does have a decent amount of carbs, but also has a lot of fiber, that has a glycemic index of 61. High GI foods, these are foods that are going to cause a rapid increase in blood sugar. Wonder Bread, pretty much any dessert that has a lot of sugar, that would be a high GI food. So now we're moving on to the last section of this guide, and that is random stuff worth knowing. Let's get into it. Anyways, the nervous system has two main components, the somatic nervous system and the autonomous nervous system. The somatic nervous system is mostly under our control. It mostly involves skeletal muscle and things like that. The autonomous nervous system is automatic, as the name would imply, meaning it's not under our control. Anyways, the autonomous nervous system is split into two parts. The sympathetic nervous system, which controls our fight and flight response, and the parasympathetic nervous system, which has to do with resting and digesting. Type 1 muscle fibers are slow twitch, meaning they have better endurance but produce less power. Type 2 muscle fibers are fast twitch. They generate more power but have less endurance capabilities. It is supposed to say endurance, not deterrence right there. So again, type 2 muscle fibers are fast twitch. They have more power, strength capabilities. They're more explosive, but they fatigue faster. In type 1 muscle fibers, those are better for endurance, but they don't produce quite as much explosive force. When we're talking about scope of practice, the least aggressive answer will usually be the correct one. Example, you have an injured tennis player client. What should you do? Answer, you're going to show the client some stretches. You're not going to take him through a full-on bout of physical therapy rehab. You're just going to show him a few stretches that might help him out and leave it at that. Maybe refer out if needed. A few different types of stretching here. You have static stretching, and this is usually holding a stretch for roughly 30 seconds. And again, this is like the typical old school, just kind of chilling here, holding a stretch. Then you have dynamic stretching, and these are movement patterns designed to mimic the workout. Take, for example, doing a bunch of toe touches. So reaching up tall overhead, moving down towards my toes, coming right back up, doing those a handful of times before doing some deadlifts. Leg swings, arm circles. There's a million different examples here. Even bodyweight squats would count. Ballistic stretching is always the controversial one, and these are kind of bouncy and swinging around, and yeah, typically these ones are no good. So yeah, avoid ballistic stretches. They're kind of crazy. If something questionable comes up in a session, like your client sharing too much information about their divorce, the correct thing to do would be to redirect the focus of the conversation back to the workout. Good to keep that one in mind. This is always a really good one to know, and you really never know when you're going to need it. So remember breakfast, lunch, and dinner. You have 7 cervical vertebrae, and you can see those guys right here. So think 7 a.m. for these first 7 vertebrae. Again, these cervical ones are right up top. Next we have lunch, and of course lunch is at 12 o'clock, so we have 12 thoracic vertebrae. Again, these are the middle dudes right here. Then what time are you going to eat dinner? Of course, 5 o'clock. Duh. So we have 5 lumbar vertebrae right here at the bottom part of your spine. You also have 5 fused sacral vertebrae. That part's not quite as important to know, but hey, you can see those guys right down here. So in a sole proprietorship, a business is owned by an individual and there is no protection for the owner. An LLC, however, does provide protection and forms are required, but they are relatively simple compared to something like an S-Corp. S-Corp stands for small corporation. So an independent contractor is a self-employed person or entity contracted to perform work for or provide services to another entity as a non-employee. As a result, independent contractors must pay their own Social Security and Medicare taxes. A worker is an employee when the business has the right to direct and control the work performed by the worker. This includes hours worked, uniforms, etc. And if you're a typical employee in a gym or anywhere else, you're going to be a worker or an employee. Making a big old pivot over here to stroke volume, and stroke volume is the volume pumped out of the left ventricle of the heart. Cardiac output is another good thing to know, so heart rate times stroke volume equals cardiac output. And again, you never know if something like this is going to pop up on the test. I wouldn't be surprised if it did. So you have 3 parts of a plyometric exercise, and a plyometric exercise is like a jumping exercise. Anyways, part 1 is the eccentric phase, and you can see this guy, he's kind of lowering down into that squat. And essentially, muscles are lengthening as he's going down there. Part 2 is the amortization phase, and this is the transition phase, or the delay between eccentric and the concentric phase. As you can see, he's almost ready to explode upwards. So it's that short but noticeable pause at the bottom. And then the third part is the concentric phase, and that is the shortening phase. Essentially, it's when the energy is released, and here I have an example of someone finally lifting off for the jump. The said principle is always a good one to know. The body will adapt to the specific demands placed on it. As far as the said principle goes, again, the body will adapt to specific demands placed on it. So if I'm doing a ton of bicep curls, my biceps are going to get really big and strong if I'm consistent and consuming protein, yada, yada, yada. Here's another thing that a lot of these organizations love. They love overtraining, which is an excessive frequency, volume, or intensity of training resulting in reduction of performance. This is also caused by a lack of proper rest and recovery. This is incredibly rare in our world as personal trainers, but hey, it's possible, it can happen. So now we have some more signs and symptoms of overtraining. Overtraining is always big on these tests. Training plateau despite continued effort. So if the person isn't making progress anymore, despite them continuing to work out consistently, that could be a sign of overtraining. Lack of focus, motivation issues, irritability, anxiousness, sleep issues, reduced appetite, elevated heart rate, and that could be at rest or exercising, elevated body temperature, muscle cramps, weight loss. All potential signs and symptoms of overtraining. None of them necessarily worth memorizing on their own, but good to look over a few times or just listen to me say it a few times. Even more extreme than that is rhabdomyolysis, also known as rhabdo, and that's the rapid breakdown of muscle resulting in high amounts of intramuscular proteins, and it can be dangerous to the kidneys. If someone works out way too hard for way too long, rhabdo is possible. Again, it is actually very rare. So you have 3 different types of levers, class 1, class 2, and class 3. None of this is worth memorizing, but hey, I'm going to say it anyways because you could get a question. For a class 1 lever, the fulcrum is in the middle, the effort and the load are on opposite sides. There are some examples over here. Again, not worth memorizing. In a class 2 lever, the fulcrum is all the way to one side, and then the load is in the middle, and the effort is on the opposite side. In a class 3 lever, the fulcrum is also all the way to one side, but the effort this time is in the middle, and the load is all the way to the opposite side. And again, there are some examples on this page, not really worth memorizing, probably worth looking over. So it's somewhat common to be asked about 2 different types of blood pressure meds. You have beta blockers and diuretics. Beta blockers lower your heart rate at rest and during exercise. A client's heart rate won't raise the same way during exercise when they're on a beta blocker, and again, that's actually why it's good for you to know about them. So diuretics increase the excretion of water from the body through the kidneys, and this could increase the likelihood of dehydration, and of course that is relevant to us. So there's two different types of diabetes. You have type 1 and type 2. In type 1, these people have to inject insulin, they are insulin dependent, and people usually develop this very early into life. Adolescence, teenage years, maybe early 20s, that's typically when someone's gonna know if they have type 1 diabetes. Then you have type 2 diabetes, and these people are insulin resistant. This one usually comes from poor lifestyle choices, and because of that, it's far more common. So if someone is eating way too much food, became overweight, they're not really working out that much, again, type 2 diabetes is typically the one that we're looking at. You never know if one of these guys is gonna pop up on the test, so good to go over them now. You have dyspnea, and that is difficult or labored breathing. You have syncope, which is fainting. Then you have orthopnea, I think I'm saying that right, and that is the sensation of breathlessness in the recumbent, essentially laying down position, relieved by sitting or standing. Falling is the #1 claim made against fitness facilities and professionals. Another good one to know. Falling is no good. So now I have a quick trivia question for you guys. What diet is most often recommended to lower blood pressure? Is it A, the DASH diet, B, the keto diet, C, the vegan diet, or D, the lacto-ovo vegetarian diet? For whatever reason, I just see this question pop up a lot, so good for us to talk about it a little bit right now. So the best answer here is A, the DASH diet. If you see a question that's asking you about lowering blood pressure, there's a good chance the answer is the DASH diet. So the DASH diet is a heart-healthy eating plan that emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy while limiting sodium, saturated fat, and sweets. It can help lower blood pressure. So when it comes to exercises, there are open kinetic chain exercises and closed kinetic chain exercises. For open kinetic chain exercises, the distal part of the body moves. So some examples would be curls, leg extensions, or bench press. If we're looking at the leg extension, the distal part of the body or the knee and ankle are moving. In a closed kinetic chain exercise, the distal part of the body is stationary. So if I'm squatting, for example, my feet are planted to the ground. Same thing is true for a push-up or a hip bridge. So glycogen is the stored form of glucose that's made up of connected glucose molecules. This is the one that is stored inside of your body and broken down and turned into ATP. Gluconeogenesis is the process of how glucose is created within the body. Protein can be used in this process. So DOMS stands for delayed onset muscle soreness. Usually this begins to develop 12 to 24 hours after exercise and is most intense 24 to 72 hours later. While we're talking about that, the eccentric portion of the lift where the prime mover or agonist is stretching, again, think the bench press, where I'm lowering the bar and my pec major is stretching out. This is the part of the lift that causes the most soreness, so just keep that in mind. So to calculate someone's max heart rate, you simply do 220 minus their age. So if you have a 20-year-old person, it would be 220 minus 20, and their max heart rate would be around 200. Know that the heart rate reserve formula is the Carvonin formula. Don't really need to go into any more detail on that. Stroke volume is the amount of blood pumped out of the heart's left ventricle with each beat, and then cardiac output is heart rate times stroke volume. So osteoporosis is a bone disease that causes bones to become weak and brittle, increasing the risk of fractures. Osteopenia is a decrease in bone mineral density that's not severe enough to meet the diagnostic criteria for osteoporosis, but it's getting there and it is a concern, so just keep all of that in mind. So a stroke is when blood flow is blocked to the brain, and some symptoms could be weakness, numbness of the face or the side of the body, confusion, dizziness, headache, difficulty speaking, difficulty breathing or swallowing. Yeah, sometimes you'll see like one side of the face start to droop. Yeah, it is good to just know what a stroke is. And again, a stroke is when blood flow to the brain is blocked. So just keep that in mind. Exercises on the floor where you're laying on your back or supine are contraindicated for pregnant people after the first trimester and for people with hypertension or high blood pressure. And since we have a person doing a bridge down here, a common mistake that people make while bridging is raising their hips too high, which can cause hyperextension in the lower back, keep all of that in mind. I've seen questions asked about that in particular. So guys, make sure to check out the part 2 video that goes over some ISSA and NCCPT trivia questions. That video will help all of you to practice answering questions and to learn more of the material. You may want to watch both of these videos a few times each leading up to the big test, especially the NCCPT one. If you guys have any questions or comments, leave those down below in the comments section. I will respond to you. On your way out of here, please don't forget to like the video and subscribe to the channel if you haven't done so already. It really helps us out and allows me to make you more free content. Thank you so much for watching. I love you all, and until next time, stay sorta healthy.